All right, welcome everybody. Thank you for joining us today. We are talking about cystic fibrosis, transplant, and knowing your body. So we all know with chronic illness that being disconnected from your body will affect you, and being able to really know your body and what does that even mean? How does that play out, especially in these situations with something like cystic fibrosis, how that might make a difference for you. So I'm going to go ahead and have our guests introduce themselves. We're joined by Ella and Jamie. Ella, would you like to, or actually I'll have Jamie, I'll have you introduce yourself first. Go ahead.
No problem. My name is Jamie. I am 33 years old. I live with cystic fibrosis, and I'm also a double lung transplant recipient. I had my transplant in July of 2017, and I currently live in Newfoundland, Canada.
Yay. And Ella?
I am 28 years old, just turned 28 earlier this month. I was diagnosed with CF at 18 months old, and I currently live in Richmond, Virginia, lived here my whole life. And I work in a microbiology lab. That's my background is biology, and I enjoy spending time outside in the yard, going to the beach, traveling when I can, hopefully can again soon.
I know, right?
Yeah.
That'll be a lot better. And then because you both have very different backgrounds. So what was like your story, like your brief kind of story with cystic fibrosis, how you were diagnosed and what that kind of looked like?
So I was diagnosed at 18 months old, and a lot of people with CF are born with meconium ileus, which is that blockage in the intestine. And I didn't have that, but so they didn't know right away that I had CF. Nobody in my family, even in my extended family, has had any history of CF, so nobody suspected it. I was just a very sickly infant. My mom would say that, I had a really hard time gaining weight. I was always sick with sinus infections, and then I caught pneumonia when I was 18 months old. And so the pediatrician was like, well, I think there's definitely something else wrong with her. So that's when they then tested me for CF. And, my parents had never heard of CF before. They were like, well, I don't know what that is, but she definitely doesn't have it.
Oh, wow.
And it turns out I do.
Yeah. All right. So,
Okay.
Jamie, what about your story?
So I was diagnosed at 3 months of age. Again, like Ella, I have no CF, known CF in my family. The closest thing they can figure out is I had a great uncle who passed away at age 2 of respiratory illness. So they believe that's where it may have come from, but I mean, it's quite a mystery. So I was diagnosed at 3 months of age, and I had, a fairly, I guess, average when it comes to CF life. I was in the hospital probably once a year in my childhood. And then obviously as I got older, it progressed.
Yeah. Wow. And why do you guys think, so since we're saying that, right? Like, so why do you think CF, lung transplants, things like that, there isn't more information about it?
Jamie, you want to take it?
Okay,
first?
sure, yeah. I think I didn't really think about, actually, when I seen that question that you sent over as the first thing we were going to discuss, it actually brought me back, because I actually didn't think about that until I actually had a transplant. And how up until I had a transplant, and like maybe the couple of years before, transplants weren't something that I heard of quite often. I wasn't exposed to people who had transplants very much. I mean, now most of my Facebook and Instagram are people, friends of mine who have had transplants. So, I also feel that lung transplants specifically aren't well known, because there aren't very many diseases out there that affect the lungs like cystic fibrosis. So it's a smaller population that's affected when it comes to needing lungs, whereas kidneys and like livers and things like that, I mean, there's so many diseases that affect those organs.
Right.
I find, like, through my exposure with transplant, it's mainly cystic fibrosis, COPD, pulmonary fibrosis disease, like things like that require transplant. So it's not something that's going to be as known to the public as, let's say, a kidney or liver transplant would.
Right.
And I also feel, to be quite honest, that CF has progressed so much in the past 30 years. You know, like my mom and I discussed this morning, how like when I was a child, I mean, cystic fibrosis was talked about so much because it was such a deadly kids disease. And now that sufferers are living into their adulthood, and, you know, we're not just surviving, we're thriving, you know, because of advances in medicine and different things like that. I just think that it's not as, I guess what I'm trying to say is like the urgency, because I mean, people are living longer, isn't there as much as it was maybe 30 years ago.
That's an interesting, I didn't even think about that. That's an interesting point. The funny thing about like the whole kidney and liver thing to me is like, when you were saying that, I'm like, yeah, because the only thing you see represented on TV shows, and they're poorly represented, is like, this person needs an immediate emergency kidney transplant, and they get it in like 5 minutes. I'm like, that is so not how that works at all. And it's always kidney and liver, and they get it in like 10 minutes. Or like the next day, I'm like, yeah, if only that's how that worked. It's like,
you know, like that is such a like a really good point that you brought up, because the medical shows actually drive me bonkers and how unrealistically portrayed.
Oh gosh, yeah.
You know, especially like you said, kidneys and livers. I mean, I think kidneys, you may know this more than me, Nika, but I think kidneys is the longest list that you have to wait for.
Yep.
Whereas, I mean, lung transplants, my best friend waited 5 hours.
Oh, wow.
You know, so,
yeah, some lists are very, very short.
Yeah.
And I have experienced, and we might talk about this at later point, but yeah, I went through the transplant process. I didn't get the transplant, but I went through the workup to getting a transplant last year at Duke University. And, you know, their wait time on their list is, I think, an average of 2 months at the most.
Wow.
And many, you know, people that I was in the rehab classes with there, like learning all about the transplant, they got their transplants when we were still going through it. And so I actually didn't get listed because of this. I was waiting to try this new medication, a very new one that's treating the cause of CF. And I didn't want to get listed because I wanted to wait to see if I could try that before I got lungs, just because the wait is so short.
That's amazing. Well, and I think so, because that's true for a lot of lists except for kidney. And the only thing I can come up with, other than everything ends in kidney failure. So you have a much bigger pool. I mean, diabetes, like everything, like every major thing ends in kidney failure. So you have a higher chance, like hypertension, whatever, you have a higher chance of a larger population with kidney failure. But then also, because we do have dialysis, we're going to live and be able to wait. So then the wait gets exponentially longer because dialysis keeps us alive. Versus every other organ, you don't really have that. So it's, you get the transplant or you die. And that's basically it. You don't have a whole lot of options to keep you sustained. I mean, there are people on dialysis for shockingly like 10, 15 plus years. So that's a really good point. And then Ella, like, so you were talking about, we can go into it, like that whole, what was that drug that you did? Like, what's all of your story with that?
Yeah. So this has been a drug in the making with a pharmaceutical company called Vertex, and the medication is called Trikafta. And so this, it treats about 90% of people with CF based on the specific mutations that someone has. And so it's something that's, you know, been in clinical trials over the past few years, and I've been really waiting to be able to access it. But last winter, I became really sick with an infection, lung infection, and I was on IV antibiotics for like 5 weeks and not having any relief in symptoms. You know, really over time, the more I've used antibiotics, the less effective they have become, including these flare-ups. And so my lung function was down to like 18%. So I was on supplemental oxygen all the time. I was just struggling to breathe even in the shower. Like I couldn't, I had to use oxygen in the shower. Like putting my hands above my head to wash my hair was just very exhausting. So needless to say, then I was referred to get a transplant. And so, like I went down to Duke, and then I was informed that soon afterward I would have access to this new drug called Trikafta.
Mhm.
And so in September of last year, I started it, and it's really, really stabilized my health more than I could have hoped. Like, I mean, honestly, it's reduced the amount of antibiotics that I need. I haven't used any antibiotics intravenously since I started like 9 months ago.
Wow.
So yeah, it's really helped stabilize me. I still have very low lung function, about like 28%, and I still use oxygen when I'm exercising. But it's really helped, and I hope that it can keep me going for a couple more years, before I'll have to cross that transplant hurdle again.
That's so amazing. So that kind of leads me into like my next thought here for each of you, because Ella, you don't have a transplant. Jamie, you do. So can you guys explain to me like how they test lung function and what that's called, and then what your respective level of lung function, I don't even know how to properly say that, but whatever that is.
Yeah, I mean,
sorry.
They test through like it's a breathing test called the pulmonary function test, and it's a measure of FEV1, which is the forced expiratory volume in the first 1 second of exhaling, and it gives a percentage or a volume in liters, and so this is what measures whether you have any kind of damage, obstructive damage in your airways. And so I've had for the past 10 years, roughly, I've had lung function in the 30% range or below. So I've really been able to hold on for quite some time, a long time, with very little volume, which is not very typical. I think that is quite atypical. Usually when you have such severe disease, it declines. Function does decline pretty rapidly. And I don't know what I can attribute it to other than really trying to keep up with my airway clearance every day. Trying to do the best that I can to manage my health, keep fit as much as possible. And then, taking the needed medications, as they become available. And so I've, like last year I dipped to 18%, but that's the lowest I've been. And now I'm back up to 28. So, I mean, to give you an idea of what I can do physically, I've now with my fitness routine, I've been able to build up some more endurance, but, I still use oxygen when I'm getting on the elliptical, when I'm just pedaling away, I use about 3 liters per minute of oxygen through nasal cannula. So I'm still definitely limited. I hope for the day that I can go snowboarding or skiing or any kind of rock climbing, some of these like really strenuous physical activities that I haven't been able to do in such a long time. And with transplant, I hope to be able to do all that again. But, for now, I'm just making the most of the volume that I have.
Totally. Wow. It's amazing.
Yeah.
And then Jamie, what about you?
So Ella brought up a really good point in that usually when lung function starts to decline, it really goes on quite a rapid pace to going downhill. And that's basically what happened with me. I hovered in the between 40s and 50s for a very long time. I think it was maybe 5-6 years. And then I ended up contracting a bacteria called non-tuberculent mycobacterium, which basically sent my lung function to a downward spiral. And I got down to 13% before I got my transplant. So it was so I kind of, it's funny when Ella said 18%, it brought back so many memories. And I got to give kudos to you, man, for being able to survive 18% because it was so difficult for me. So yeah, there's a magic number in the CF community that the medical team looks at. So when your lung function gets around 30%, that's when you start to be evaluated for lung transplant.
Oh, wow. Okay.
Because it's really around the 30% mark that things can progress very, very quickly. So in my case, I was very thankful, very, very thankful to my team that even when I was in the 40s, even though I got this mycobacterium infection, they consulted transplant right away. And I was very, very lucky to be transplanted when I did, because I remember just days before my transplant, the doctors came in and felt that I had very little time left to live.
But how much function did you have at that time?
Right before my transplant, I got down to 13%.
Okay.
Yeah, I was on oxygen. I was in the hospital for total time spent in hospital before my transplant was 550 days in the 2 years leading up.
Oh, the 2 years.
Wow.
That's still a lot. That's like a year and a half out of the 2 years. That's a lot.
It is. Yeah.
Wow.
Yeah. And even when I wasn't in hospital, I still wasn't functional. You know what I mean? So the transplant for me came at like the perfect time. Like I was very lucky to have survived.
I think that's something that, a lot of, obviously if you decline very, very rapidly, you don't have that period of time where you're weighing, well, how much is my quality of life really affected by my
Right.
illness? How much can I still do versus the time that it requires for me to stay alive,
Exactly.
just to do all the treatments. And I think, for me, I've kind of, for a long period of time, have been in this limbo of where, there are periods of time where I am worse, in the past couple of years where I'm like, I can't sustain this, I can't do this for much longer. Yeah, I'm not like on my deathbed, like at 13%, but, it's getting harder. I can't go for more than, a couple of hours without doing treatments, and I can't breathe enough to do what I want to do in my life, to find to be fulfilled in what I'm doing in my life.
Yeah.
And so that's something that I've struggled with, a number of times at different periods, over the past couple of years with, well, when is the right time? And right now, obviously I'm in a good place, and I think I can stay stable, but, it's definitely difficult when you are when you're not faced with, yes, you need it right now or you are going to die, but it's like, well, when is the pros of transplant outweigh the potential for, the fact that the reality with lung transplant, and, you can talk about this more, Jamie, but, the survival, I think, for 5 years after transplant is 60%, or at least that's what it was as an average in the United States recently. So, there's definitely benefit, but there's also,
for me, that was such a mental struggle before my transplant, was like, okay, knowing when, because like you said, there's such a mind thing that happens when you have CF, because you don't want to get your transplant too fast, because then you enter into that stage of, you have a transplant and you know that there's a shelf life, and you know that there's this pressure to maintain your lungs, and that things can go wrong even with new lungs. But then at the same time, you're like, well, I'm not really living my best life with the lungs that I have. So it's, for me, like I relate to you so much, Ella, in that it's such a mind struggle when you're trying to balance out, okay, is this the right time? And then I often found too, Ella, I don't know if you can relate, but like, you have better days and bad days. Some days you feel like you can put it off for years, and then other days you want it tomorrow. So like for me, it was such an inward turmoil of trying to figure out, like, but luckily, like for me, I didn't really have a choice. It was like, you either get a transplant or you're going to die.
Right.
So I didn't have that slow decline, which, kudos to you for being able to suffer it out.
So that makes me wonder, like, because yes, I know kidneys, but I don't know anything else. So because like with kidneys, you don't feel kidney failure. So it's a double-edged sword. So you're lucky in that you're like, life is fine. Like, which also makes it really mentally difficult when the time comes, if you haven't been feeling it, because you're like, wait, what? I feel fine. I don't understand.
Wow.
There's a mental game there, because until it's too late, like down to like super little function, people hallucinate, throw up, whatever, until that point, other than being tired, you don't feel a whole lot. And so that's why people also have a mental difficulty grappling with the changes in dialysis and transplant, because you're like, I don't understand, right?
Yeah.
But the lungs are your lungs. Like, you gotta breathe. So you feel like, what can you guys explain? Like, what does that feel like? Like, you're talking 30% and above, and then below, and that 13, like, what do those different stages feel like? And then after that, Jamie, what does it feel like post-transplant?
So for me, like hovering around that 40, 50, I definitely felt limitations, but I mean, I had a really good quality of life for, like I said, 5-6 years. I was working. I was able to do things, you know, fairly normally. I wasn't on any supplemental oxygen. But once I got down around the 30 mark is when I really started noticing, like Ella mentioned, like being in the shower and like raising your hands up, or like having to just do like simple things like exercise, going for walks. I really found difficult. Sleeping. I used to have really bad back pain. I used to only be able to sleep.
Oh, we lost him for a second.
So
Jamie,
what?
you want to start back just a second? It cut out and then came back in.
Okay, yeah. So yeah, like I just noticed different things, like with sleeping, like I couldn't sleep on my back anymore. I had to sleep on my side. I started coughing. I started having wheezing. I started having really weird noises coming from my lungs. And like with cystic fibrosis produces a lot of mucus. So it just became impossible for me to clear all that stuff out. I could do physio 50 times a day, and it would just keep on coming, because my lungs just failed to the point where they weren't able to keep up with the mucus production.
Wow.
Yeah, exactly.
You've both mentioned this, and I don't know what it is. So, because Ella, you called it something, and then you just called it physio. What are you guys referring to? Like certain exercises for your, like what is that?
Yeah, so it's forms of airway clearance.
Okay.
Basically to remove the mucus from the lungs.
Okay.
And these entail inhaled therapies. So actually I have one right here, but this is like a nebulizer.
Oh yeah,
And so, you know, you put it in your mouth and then you hook it up to a compressor, and then you basically put medications in it, and then you inhale them. So these medications open the airways, kind of loosen the mucus, and then you need to have a way to expel the mucus. So then I do different kinds of what's called PEP devices, so positive airway pressure. And this thing's like, I just have them here, but
here we go.
How convenient.
This is, I think it's called the Vibra PEP, and basically it oscillates. There's a thing in here that makes the airways oscillate, so it then moves the mucus from the airways to loosen it. And then I also have a vest, which is, it's kind of heavy, but it's a really, and you just put it on. It's a vest, and then there's two different kinds, but one of the ones I have is like it blows up with air, and then the frequency vibrates the chest, so it just like it just like moves your entire body and to loosen the mucus. But that also it's not an active form of airway clearance. It's just another way of loosening it. So you really need these. Really, I haven't been, over the years, I've had periods of being more involved with my airway clearance exercises, meaning like sometimes I'll just do the vest and not do these active coughing treatment, exercises that I think are really important. That I think a lot of people don't focus on, at least in the US, because we have the vest, but like these PEP devices, and then just what's called autogenic drainage. And these are breathing at different lung volumes to move mucus from lower in the bottom airways up to the higher airways, where you can then easily cough it out.
Wow. How long does that take?
So it's pretty time consuming. I mean, now with that I've started Trikafta, this medication, I have been able to very fortunately, do maybe like one less treatment a day. But before that, I'm still doing 3 every day, no questions, to remove this mucus. And each one takes for me about 45 minutes.
Oh, geez.
Yeah.
Wow.
Yeah, it was basically the same for me. Like before my transplant, it was just basically what I lived to do. I lived basically to do airway clearance because it's so time consuming. Because like Ella said, you have to do the pre-treatment of the nebulizers. You have to give that time to sit in your lungs to work its magic. Then you have to do, your different forms. And everybody with CF, like through my experience that I've talked to, has a totally different regimen for what works for them. Because you get to play around with like the different techniques that your local team offers you, right? And I was very lucky to have a really, really good physiotherapist. So like everything was on the table, and she basically said like, whatever works for you, that's what we're gonna like master. Right. So like I related to so much that you did, Ella. I had a vest, I had the autogenic drainage, I did the PET mask, and I even did like manual percussion, which they used to do like old school. which is where you cup your hand and you like basically beat the crap out of yourself.
Oh my gosh.
And that
I didn't even mention that one, but yeah, my parent, I don't know how I forgot, because my parents used to do that to me all the time.
Yeah. So like all those methods, I mean, like Ellis, like it used to take me all day because that's all I would do to try and stay healthy.
So what happens if you don't do these?
You get
What
sick.
happens is you get a buildup of the mucus, and then that mucus is sitting there, which cultivates bacteria. That bacteria leads to major infections, which basically leads to damage in your lungs, which leads to you dying faster.
That's it in a nutshell. Yes.
I don't mean
Right.
I don't mean to be so blunt, but basically,
No.
if you don't do your airway clearance, you're going to die a lot faster than if you don't.
Yes, and yeah, and it's also just, obviously when you have more lung function percentage, maybe you don't feel the buildup as quickly. But when you get down to volumes like, in the 30%, if you don't do one treatment, you're going to be feeling it. And you're not going to want to skip it because you won't be able to breathe.
Oh, my God. Yeah. I can't even imagine. That's so crazy to me. And then, so we were talking about like what it feels like as your lung function's declining. So then, Jamie, you were down to like 13. What happened post-transplant?
So, oh my God, I'm going to try not to get emotional now because it's been so long since I've talked about transplant. But, I don't know if you've ever been on YouTube and watched these videos of people waking up from transplant and getting the tube taken out and just the look on their faces. But like for me, it was such a night and day feeling. And I mean, post-transplant, you don't have your full ability to breathe right away. People don't understand this. It's not like you wake up from surgery and you're like, boom, you're at your max potential. Because your lungs have just been through, even the donor lungs have just been through something very traumatic. They've been taken out of one body and put in yours. So it took me a good 6-9 months before I was able to fully feel. But even just right away, I think my first breathing test was in the 40s. And I felt like it was in the thousands.
Because compared to 13%.
Compared to 13%, I mean, just the ability not to have oxygen, to be able to go to the bathroom without feeling like you're going to pass out, to be able to take a sensible shower. I mean, it's unbelievable the difference that you feel. And then, so the max that I went to, I think, was 116%, which was basically over the predicted.
Right.
Like what the machine predicts
the
that
average,
you to be.
Yeah.
So it was just it's such a stark contrast. Now, sadly, I had a really bad bout of rejection in the fall of 2018, so I've actually lost a lot of my lung function again. Not near as much as what I was before, but like I've been reminded of what it's like to be a little bit limited because I'm getting back into exercising, and I'm like, oh God, I can't do what I could when I first had my transplant. So it's very interesting to me at the different levels of your lung function, the things that you're able and not able to do.
I wanted to ask you if I could interject, but like what, so you were able to fight off the rejection and you've been fine now, like you have no rejection. Maybe you could also talk about what rejection is. I don't know if we want to get into that.
Yeah.
But.
So, this is going to be really hard for me to talk about because it's something that I have a lot of shame about. And I'm still dealing with mentally, but after my transplant, I went through a very severe depression. I dealt with severe survivor's guilt. I had a lot going on in my personal life, and I stopped taking my anti-rejection medications. So I basically put myself into rejection. So I was really lucky in that I got to the hospital. I was in the ICU for 2 weeks, and basically when they restarted my anti-rejection medication, it basically just saved my lungs. So I don't really like to use my case as like a rejection case, because it doesn't really qualify as what like most people struggle with rejection. And like I said, I deal with a lot of shame from it. I talked about it on my social media a little bit, and I got so much hate from different people with CF and transplant, and it really like took its toll on me, and I've been continually dealing with it. I've gotten to a place now where I've forgiven myself for doing that, and I know in my heart that I'll never do it again because I've done the proper steps to make sure that won't happen again. I'm not even going to get into that because that's a whole different topic, but for most people, rejection is something they can't help. Rejection is when your body, the cells in your body can develop a resistance to your new lungs, and they start to attack the organs. So I mean, like you know what kidney rejection is like. So it's essentially the same thing in that your body just says, these don't belong here. We're going to attack them. And unless you do the proper things, like there's many options that they can do for a rejection. And then there's different types of rejection. There's acute rejection and there's chronic rejection. So the rejection that I had was like an acute flare-up, in that I wasn't taking my medication properly, and it caused that to happen. And then when I put the medication back in my body, it saved them. So
Jamie, what's your lung function now?
My lung function is in the 60s.
Okay.
Yeah. So, I mean, and the only time I feel limited is when I'm exercising. And I'm starting to believe, especially now that we have really terrible weather here in Newfoundland. So it's only now that the weather's starting to get nice. And I'm starting to notice that it's not my lungs that's causing me to hold back. It's I'm just out of shape.
There's that happens.
Yeah.
Ella and I, before you got on, we're talking about like trying to stay in shape during quarantine and like staying active. So that's totally valid.
Yeah, I'm just really deconditioned because my physiotherapist, again, she's such a great motivator. She's like, you know, you can do it. You just got to do it.
Yes.
You know, and like I just found, like the other night I went for a bike ride and I had to walk my bike 80% of the time. And you know what? I got home because I was feeling defeated. I was going to call my mom to get her to come pick me up. And I got back and I was like, you know what? I just did it.
You did.
That's right.
I did it. So, and I was so proud of myself. Like, even though I had to walk the bike 80%, and I was like, what are people thinking? I just did it. But through that, I'm just learning that I don't think it's my lungs that's holding me back, because when I'm out of breath, I recover so quickly, but it's my body is just so out of shape.
Yeah, I think, you know, to your point, the motivation to really do what we can for ourselves to improve our health, or, you know, in all aspects of life. I think that's what keeps us going, you know, and that's what really allows us to live through all of this. You know, I think mental health can be such a difficult obstacle to our physical well-being. You know, I think that they definitely go hand in hand.
And further to your point, Ella, I also felt that people with CF, I mean, we struggle with this disease our entire lives. We just want to be normal. So sometimes, you know, we don't want to do the physio. We don't want to have to put in the extra work that it takes for us to just be able to live, because we see everybody else who are just like, get up in the morning and go, and they can do whatever they want. And we envy that. But I certainly relate to the mental health aspect. And if anybody's listening to this now and you're in the process of either entering transplant or considering transplant, my biggest advice that I would give anybody going into transplant is focus on your mental health. Because the doctors and the teams are so there to take care of all the physical stuff, but you've got to get your head in check and be prepared for what you're about to enter. Because I wish somebody had to have not warned me, but had kind of took me aside and said, like, this is going to take a lot out of you. And for me, I had a lot of childhood traumas and different things that like attributed to my demise. But the mental aspect, like Ella, I totally agree with you. It's such an important part. And I also have learned that when you're not there mentally, the physical follows. So wherever you are mentally, that's where you're physically going to be.
Exactly. Yeah.
Yep. You know, like if you're not all in mentally, then you're not going to be all in physically. Yep. And once those two things for me got in sync, that's when I started, like I can't believe I'm saying this, but like the past year has been the best year of my entire life with my health.
Yeah.
And it's because I've put in the work to get the mental and the physical on the same part, you know?
That's super true. Well, and the other thing, because you were saying like people gave you a lot of hate and everything, that people don't understand is that the medications you are put on for your transplant mess with your head.
Yeah.
That's
I've heard.
Especially if you're on steroids, like for kidney, that you can do some non-steroid protocols. But even that, like even the non-steroids, those ones mess with they mess, like people have, I mean, rage, people have like like every emotion under the sun, and like, and even now I'm 13 years out transplant, and even when we adjust my dosage still a little bit, even not like just my regular transplant meds, like your body changes, you feel a difference, things change. These are the things that people don't talk about. And if you're not prepared going in, like you're saying, and people don't help you with like, here's what's going to happen, because so many people in the kidney world, and I would assume it's similar for you guys, assume I'm going to get a transplant, life's going to be great, and I can go about my life. And it's like, no. You're going to go through every hormonal possible feeling known to man 20 times a day. You're going to have every emotion, everything, and you're going to deal with side effects, and you're going to deal with all these other things. Like there is that aspect, and we're all going to battle that.
So I'll just add an extra element to that though, with Nika, is that when you have a lung transplant, not only are you dealing with those, reactions from medications, when you have such little oxygen going through your body, that affects your mental health. That alone.
I believe it.
Your brain function is affected. I didn't know this until after my transplant, because listen, I'll be the first to admit it. I turned into the biggest asshole going through my transplant. Like I look back on it now and I'm like, you know what? It's a wonder that I had my family and friends stick by me, because between the pain medication, the low oxygen, all the other stuff that I was being given, plus, like I said, my traumatic childhood that I had, it's a wonder that people didn't be like, you know what? Just put a pillow over him and let him go. No, like seriously, I have a lot of regret about how I treated people. But again, I've also learned through therapy and counseling that a lot of it was out of my control. A lot of it was things that, just the circumstances of what I went through.
Yep.
And going through transplant is not easy. No one should be naive to think that it's like a walk in the park.
Nope.
Because it's not.
No. And that's so true. And that's the thing. And I think people don't realize that. And there's people who just go in blindly, just being like, I'll do whatever. I just want to feel better. Like, because at least in the kidney world too, because people have dialysis, if they're doing relatively okay on dialysis, they're in for actually a bigger shock when they get transplant, because they hear so many success stories. They assume they're going to wake up from transplant, life's going to be perfect. It's not. Like there's still stuff you have to go through. You deal with medication changes. You deal with like all these things happening. And I've heard so many people be like, I actually feel worse the first like 6 months after transplant than I did on dialysis. It's like your body's adjusting. You have to, I thought I'd go back to work in 3 months, and it took me 6 to 9 because I was throwing up almost every day from my medication. Yeah. And I'm like, well, this is fun. Cool. Yeah. Good to know. Like, you'll be back at work at 3 months. I'm like, nope, I'm throwing my medication up every day. That's not happening.
And then, you get in your head then, and you're like, what the hell did I put myself through this for if this is going to be my new life?
Yeah.
And when I was going through the process last summer, and I was at Duke, and we basically had to do 2 hours of cardiopulmonary rehab every day, and then also take classes. So it was like a 1 month program leading up to it that everybody that was going through lung transplant was required to do. And so, I've heard like there was obviously a lot of older people, because as we talked about at the beginning, a lot of people that get lung transplants are elderly people having, COPD and pulmonary fibrosis and things like that. So, and they were not, they were not prepared for what was going to happen, even though these classes were, telling them, they were like, yeah, I'm going to get through this. Like, I'm going to get new, all my old lung, feel like my old self again. And, I think if you're not prepared and you don't know, really what it entails. And I think those of us with CF are much more prepared to take on post-transplant life than a lot of people with other conditions, because we have, done the medications all our lives. We have had to do these rigorous treatments and at certain times in the day. And, to an extent, yes, it is trading like one disease for another, but, hopefully it will be a lesson, less maintenance required, and feeling better. So I think that we are a population that is definitely equipped in general to take on post-transplant life. And I think, the statistics have shown that I think we do relatively well. One, because we're a younger population versus, most of the other people that are getting lungs. And because of this knowledge on how to take care of ourselves, how to advocate for ourselves in health situations. So I think those are all factors.
That makes a big difference. Well, and I also you touched on something that I often think about, because I've had kidney problems since I was a kid, but it didn't affect my childhood. It really didn't come in until I was 19, 20, went on dialysis. My transplant was at 21, and everybody at the dialysis center was 70 and over, right? I was and my transplant center, I was one of two people who was 20. Everybody else was way older. But I have clients, and there's been people throughout my life that get different diagnoses that are serious later in life, 60 plus, stuff like that. And they are so intensely devastated and distraught for what I feel is a longer period of time than people who are younger and used to being sick here and there. And so I think that's true because, and what I tell my clients as I've had bumps in the road, because again, transplant isn't a cure, it's a treatment. Things are going to happen. And people are always how do you handle this so well? I'm here's the thing. Once something's happened once, the second, third, fourth, fifth time is a little bit less of a blow. You're kind of I kind of expect some of this, whatever. It's that first blow that is the most devastating. And if you've gone the majority of your life, 50 plus years, feeling invincible, that's even more of a blow than you've had. Because as a kid, I had asthma. I've been on nebulizers. I was always at the, not always, but every year at the hospital for one reason or another, the bad flu, whatever. And so I was familiar enough that it's when it finally came, it was a blow, but it wouldn't be the same as to me anyway, as to somebody who was 60, who's been invincible. And then all of a sudden it's a whole new world. I think those are two totally different things.
I just couldn't agree with what you're saying more, to be honest.
Yeah. And so for you guys, because you've talked about the different lung function levels and how you feel and what you're able to do. So obviously, when you have a certain amount, you're not on oxygen, you're able to do more, you have this issue. But then when you are on oxygen and things change, you can't hide it. Family, friends, what happens when that change happens? Because I have to imagine it's kind of you become a different person a little bit, right? Because your whole life has to change. How did people around you guys respond to that?
I think people respond to you the way that the vibe that you give off. I think if you feel comfortable with yourself, other people will feel comfortable with you as well. And you're going to have people that look at you and ask questions. I've had that happen. Luckily I've been fortunate that, I haven't, if I don't wear oxygen, people out in public don't know that I have CF.
Right.
So I still am able to hide it, in a lot of situations, but in those few times where, I have needed to be in public with oxygen at periods of time when I've been sicker, I think that it's just shaped me to be more honest and forthcoming about my situation and my disease. And, over time, I've become more comfortable with it. And I don't really experience intense dread. I mean, I have one moment where I do recall, definitely feeling like I wanted to melt into the ground. But, it's just, I've come to accept that it's a part of my life. And it's, at this point, it is going to be even more so in my future. And so I think when we accept ourselves and allow us to be, it allows us to be more open and honest. And really, I just think it improves our relationships with other people. So that one situation, I guess, that I can think of is one of them. Well, it was where it was in 2017, I think. I was in the hospital I was at Duke in the hospital. I had a lung collapse at the time. And I was needing supplemental oxygen all the time. But I wanted to get outside from the hospital room, go for a walk. And I was on Duke University, the hospital is on the Duke campus of the school. And so, I'm in my 20s and the campus was quiet until the classes let out. And then I'm there with my mom walking with an oxygen cannula through campus. And I'm like, oh my God, I can't, I do not want to be here right now. How did this happen? Why did I walk this direction? Right. And even though none of those people knew me, it's still hard to have it be visible when you feel so vulnerable or weak. I think I've done a number of like speaking engagements where I talk about CF, I talk about my health, I talk in detail about how vulnerable I have been in the past, with needing treatments and all this stuff. But in those times, I feel very empowered for people to know about my disease, and to know and to feel like I'm an expert in it. But it's when I am looking feeble or, not showing how I'm able to conquer CF, because I'm not, it's conquering me. It's difficult to accept those. But like I said, it's really a mindset. I think if you accept who you are, other people will as well.
Wow.
Yeah.
So, yeah.
So
Go ahead, Jimmy.
for me, like, I was extremely lucky because I had a mother who just taught me to never be ashamed from a very young age of having cystic fibrosis. So I would tell everybody, I would tell strangers, I would, if anybody looked at me funny, I'd be like, listen, what do you want to know? How can I educate? I always looked at things as an educational opportunity. And even today, like, I don't hide my CF, I don't hide my transplant. It's something that I'm actually intensely proud of, because I feel like cystic fibrosis and transplant has shaped the person who I'm proud to be today. So I've never hid it. I think, though, that it was really hard for those who love me most and my friends to see me going from somebody who loved life and lived life so loudly and energetically to being so defeated by having poor lungs. I actually think that it may have been harder on them than it was on me, because I was feeling it gradually, whereas I think some of them felt like it was almost an overnight thing where, I just became so incapable of doing just the simplest of tasks. So I have to say, like, I think it was hard and stressful for a lot of people who were in my circle of care to see me go from, and two, I sadly, I allowed myself to feel defeated. I allowed myself to be in the mindset of, well, CF is winning. And I think that was a really dangerous thing. I didn't mean for it to happen, but I mean, when you're feeling so low, it's very hard for it not to, because CF is a really difficult disease. It affects every aspect of your life, every aspect of your body. So for me, it just changed. So I think it was hard for those around me to really see me go through that.
Yeah, I get that a lot. That makes a lot of sense. And you've both kind of touched on something that is something like I've struggled with and dealt with, is this idea of what you're showing to the world. Like, you feel like, Ellie, you were saying, like, you feel empowered and on top of the world when you're the expert and showing this example, but then you feel defeated when it looks like it's beating you a little bit. And I think that's so interesting, because like I've felt that and I've seen that, because I'm always about like, look at me, I can do whatever, forget this disease, blah, blah, blah. But I always wonder, like, as I'm getting older, because when you're younger, you're just like, whatever. But as I'm getting older, I'm like, but wait, that's totally part of it. Like, aren't we empowered more, or shouldn't we be empowered more in those moments too, where it's like, I'm battling the thing that's like fighting me. Like, I am fighting this. This is my strongest point. Not when I'm just putting on the brave face for everybody else, but when I'm in the toughest part of this. That really should be our most empowering, because other people aren't going through this shit. They don't have to fight this. It's easy to put on a smile when like life is all freaking roses. But when you're fighting something that's battling you, like, that's when you're the most empowered, even though I know in the moment it doesn't feel like that. But that's when you're their strongest.
Absolutely. I definitely agree with that. Yeah, I think, like you said, in the moment, at least in the moment, no, I don't feel like I'm the strongest. I'm just trying to get through one day at a time, and trying to get to the other side of this. But yeah, definitely looking back, I think that we can all feel proud and empowered by what we have, overcome in our lives, all the different health and hurdles that we have, now become stronger from.
So for me, my motivation for when I started speaking out about my rejection and how it was really self-inflicted, my motivation and my intention through it from the very beginning was to help people realize that you need to prepare yourself mentally for going through transplant. I mean, that was my first and foremost motivation. I had so much childhood trauma that I didn't have resolved that I carried with me through transplant. I was so angry. I didn't have proper avenues that I vented to. I didn't have proper support systems set in place that I should have. So my motivation from the very beginning and opening up and talking about that was to help people going into transplant. And when I started getting so much hate and anger from people amongst the community that I so feel like I belong, and that is the CF community, it really shook me to my core, because I'm like, I would never, ever look down on somebody for their choices, especially when those choices were made out of not thinking clearly or things that have happened to them. So it really took me a long time to be able to like open up to even my CF friends again, because I felt so judged and criticized by. And then when I went to counseling and therapy, she made me realize that most of those people who were giving me such a hard time were people who haven't been through transplant yet. They have no idea. They have no idea what's entailed in going through transplant. They have no idea. Mm-hmm. And, that it really helped me appreciate that, we can all sit behind our computers and our laptops and whatever and judge people and make, judgment calls on other people's journeys. But until you've walked in their shoes and you know the history and the full story, we really should be kinder towards others and really respect other people's journey for what it is. And, I've grown so much in the past year since that whole episode. And I really feel like I'm finally in my life in a really good place. And, it's just taken a lot for me to have that sense of pride, like Nika, that you're talking about, in that looking back on that now, I can say, you know what, it sucked that I went through it, but the fact is I got through it. Mm-hmm. I'm here, I'm still here, and I'm still kicking ass.
Yep.
And I'm using my struggles and my journey to inspire other people and, lift people up. I mentor as many people as I can who are either starting the transplant process or going through the transplant process, and I'm doing what I can to pay it forward.
No, that's amazing. And I think here's the thing too, like when you're talking about people giving you all this hate, I think the thing is, and you had talked about earlier about having shame about what you did in your choices, but you're not the only one that's done that. There's lots of people that have done that. Actually, I was just in a forum today where a girl was talking about her kidney function levels from her transplant are declining. And she goes, it's my own fault. I smoke, I drink, I don't take my pills, and da-da-da. And I'm like, all right, well, you have a choice. You still have time to recover this. And at least she was like open enough to say that. But that happens actually a lot. And so you being able to have the strength and the vulnerability to come out and talk about it forewarns other people so other people can be more prepared. Yeah. So hopefully it prevents more. So there's a lot of strength and empowerment in that too, because other people just won't say it. They'll just hide it and they'll make up.
Exactly. Yeah. And so right. And I've actually been told that by a lot of people, that because I felt like, oh, this has never happened before. I'm the first one to ever do this. And then when I got on the Facebook groups and learned, talking to different people, and I found out that, listen, it's happened a lot more. People just don't talk about it. Mm-hmm. Whereas like I said, my motivation is to like inform people like, this is going to be hard. This is going to be tough. Yep. Do whatever it is you feel you have to do to get yourself in the best shape, both physically and mentally. Because for me, like, it just, like, I don't know, Ella, if you can speak to this, because, I mean, you're in the United States, but during the transplant assessment process, did you find there was much evaluation of where you were mentally?
I mean, actually, no, not really. They did have like I guess a mental health meeting with a psychologist. So the psychologist is a component of the transplant team. I don't know how it is, where you are, but at least at Duke it is. But I guess I have to be honest, I have handled it pretty well overall. I think that I have an amazing support system. My parents, friends have all been very supportive throughout my entire life. And so I've never had too severe, bouts of, feeling down or hopelessness or anything like that. So, I think that maybe they weren't you know, and as far as how I was acting, you know, they were really not paying attention to me and like my health, you know, my mental health aspect as much as maybe some others. But yeah, I definitely think that to be able to get through, you know, something like transplant, you got to have that mental strength, because it definitely defines your outcomes. I mean, there's no question.
Well, it's not just that, like, so for on the kidney side, and I assume it's pretty similar everywhere. There's a social worker who does an evaluation at all the hospitals, right? And like, they will deny you, or they'll make you like. So I was like 20, and
That's true. Yeah.
I just like left a doctor who was awful, and because I was young and I left a doctor who I thought was awful to find a better doctor, they thought I would be non-compliant, so they denied me for a transplant. And because somebody who was my age just got a kidney, then went out and partied a bunch and drank and blah, blah, blah. Her kidney transplant failed and it affects their numbers. And so they're like, nope, we're going to be extra cautious with young people, whatever, right? So they made me see a psychologist for 3 months. They made me do all this stuff. And that happens. Like I know a lot of people online who have been denied and some have been offered that option. Like you have to see a therapist for 3 months. They have to sign off. They have to whatever. And then some nothing, you know, like there's nothing in the beginning, whether there really is something or isn't, but then after from the medications and everything else, because once you've had a transplant, the social worker doesn't give a crap about you. That's just the way you get approved. Post-transplant, it's more about let's keep this kidney alive and then everything else. So to your point, like post-transplant, there is no real aspect of what are we doing for the mental health of the patients. There is a pre-transplant to make sure you can mentally take it for the most part. But post-transplant, there is nothing. So that's really true. That's a really interesting point too. So then that makes me lead into this next part with you guys, because you've both had similar and different lives, you know, similar diagnosis, but different paths. What have you learned about yourselves in this process?
You go first, Ella.
All right. I mean, I've learned about my physical health, obviously, through my entire life of dealing with CF. You know, I've really become very in tune with how I'm doing. But outside of that, I think I've learned to really just accept myself for who I am. And I think I talked about this before, but, you know, trying to be positive, learning that staying in the moment, just like living life one day at a time, is really the best, the kind of, at least I have found, to be my method of coping, of, you know, building resilience, of being, you know, enjoying each day for what it is. Because, you know, we don't know how many more we're granted and what tomorrow might bring. And so I think it's really shaped me. You know, I say CF is like my greatest blessing, but my greatest curse as well. Because, you know, it's obviously brought a lot of health challenges, but it's also allowed me to have this perspective, to really make the most of the now. And I know it sounds cliche, but I think it's really true. And, you know, embracing what we have and finding joy in that, even though even though, you know, my life is limited, but making the most of what I can. So I think I've learned a lot of life lessons that I think early on that I think, you know, a lot of people take much longer, a lifetime to figure out.
Yep. I can totally feel that.
Yeah. So my thoughts are very much the same as Ella's. The only thing that I'll add is that I've learned that I'm a hell of a lot stronger than I ever imagined that I could be, ever will be. You know, like life continues to give me just hurdle after hurdle after hurdle, and I just keep overcoming them. And it's easy to get caught up in the moment when things aren't going, you know, as we plan, and, you know, get down on ourselves. But I just find that I just take those moments to reflect on everything that I've been through and everything that I've conquered in my life. You know, in the short 33 years that I've been alive, I'm a childhood rape victim. I'm a childhood survivor of being raised in an alcoholic home. I've survived leaving a religious cult. I've survived, attempting suicide because of my sexuality. I've survived a double lung transplant. So like, I've just survived and survived and survived. And it's just taught me that I'm so resilient and that I can get through anything. And further to, again, echo what Ella said, it's just taught me so much about life that people wait until they get in their 70s and 80s to find out. Like the realizations that I have, even going through this COVID stuff, like I just find, I don't know about you, Ella, but I just find I'm dealing with it so much better than so many people around me, because CF patients are so used to being isolated. They're so used to not being able to do what they want to do. Like I see people like on Instagram and my Facebook having like mental breakdowns, and I'm like, girl, you need to calm down. This is just a walk in the park for us, you know what I mean? So it's just really taught me that, like, the value, and I totally agree with Ella. I think it must be a universal thing that CF patients feel, and that CF is a blessing and a curse, because if I could choose, and this is going to sound really, really bad, but if I could choose whether to live a life with CF or not CF, I would totally choose to live a life with cystic fibrosis. Because it's taught me so much about just what's truly important in life. And I've gained the most respectable relationships with people. And, like I treasure like the simple things. Like, again, it sounds so cliche, but even just like sometimes when my nephew's around, I'll just stare at him and I just feel so grateful that I'm alive just to see him grow. It's amazing what CF has taught me.
I love that. Yeah. I feel the same way about my kidney disease. My mom always thinks I'm like lying or something. I'm like, no, I know who I am. I would have been an awful person without my kidney disease. I would have been so bad. Like, I'm not a nice person. Like, I would not have been like, I'm sorry. I know who I am. Like, it is like, I travel the world. I do things that I wouldn't have done. Like Ella was saying, like it is all these cliches. And it's so funny because I would have been like, if I would go back in time and hear myself now, I'm like, who are you? Because it is so true, like living in the moment. Because when I had my transplant, I promised myself one thing, and it was, I'll plan for the future as long as it doesn't get in the way of living for today. Because I used to be so hung up in the future and everything else, and I'd never enjoy myself, never do the things in the moment that make you happy. And that's what these diseases, I feel, do if you're willing to pay attention and deal with your emotion, is make you go, okay, what really matters? What am I going to put my energy towards? What's in this moment? My family, the things I love. Jamie, you just went to your cabin and you were outdoors recently. Like those things that we love in the day to day. I love traveling. So I leave the country a couple times a year. I would have never done that before. I would have been too afraid that like it's going to hold me back somehow. Like those are the things. And it's so awesome to see you guys doing that. And then especially right now with everything going on, like Jamie, you started talking about it. And I think it's true, like with COVID-19, everyone's freaking out. I'm like, I'm a post-transplant patient. I've been living this life for 13 years. I've been wiping things down. I've been like, welcome to my world. Here we go. Yep. Is there anything else about COVID-19 that you feel has impacted you guys, like one way or the other?
I think like I'm both like what you guys said, I'm not overly fearful. We know how to wash our hands. We've been wearing, at least with CF, we've been wearing masks in the clinics all the time. Now everybody's wearing masks, so it's just less of a deal anyway. I've still been doing the same. I work primarily from home anyway, so I've still been working. It has, obviously it's affected all of us, to an extent. Obviously I haven't been able to see friends as much or, just to do my normal life, but I'm very fortunate to still have, my resources and income. And I've just really not, felt much fear. I haven't gotten sucked into the media blasts, all this. I think that, like I said, focusing on that, like one day at a time approach mantra, just keep, what can I do today to work towards my goals, keep up my exercise routines. I've been even more disciplined now in quarantine. So, it's not been bad. And I think that I've, I don't want to, I think it's important to have a balance between taking precaution, but also living your life in the way that you want to be fulfilled. And so I think that this means that, yes, I think that, when things do open up again, here in Virginia, we're in like phase 1, but, when things do open up again, with taking precautions within reason, but, doing the things that you want to do. I think we've talked about it. We've all been through many difficult health challenges, and, I've had pneumonias, collapsed lungs. I'm not saying I'm invincible by any means, but, let's do what we can. Let's also enjoy our lives. Don't live in fear. Just take what tomorrow brings. And, I think the rest of it is kind of left up to the man upstairs. So that's just my opinion.
Yeah.
Yep.
And like for me, like I said, looking back on everything that I've survived in my life, I'm not going to let something like COVID-19 just suck the joy and, whatever out of my life. And I'm not going to spend my days sitting at home watching TV and living my life in fear, being sucked in by because I do believe strongly that there's a degree of fear mongering that's happening. And, people are, do tend to go to extremes a little bit with the things. I mean, I don't know how many, I think there's like 7 billion people in the world and there's only 5 million cases worldwide. So, I mean, I just feel like, again, like Ella said, cystic fibrosis has prepped us for this. Yeah. Like kidney transplant has prepped you for this, Micah. This is nothing new for either of us going through a pandemic. We do all the precautions that, everybody else is now obligated to do. We've been doing them our whole freaking lives to stay safe and healthy. So it's really like, it just feels like another day to me. The hardest part for me, again, because I have such a mental health struggle, is the not being able to go see friends, not being able to be around people, because I am a people person. I'm an interior designer, so my work has totally shut down. I can't go and decorate someone's houses, obviously. So like I've been out of work for 10 weeks. So those things are what's affecting me more than the actual virus and the fear culture that's happening is affecting me.
I was just going to say that too, because I think it's like all those things that we're saying is so true. It's like we've kind of been prepped for this in our own ways with our illnesses, but it is that social aspect, the interconnectedness that is a little bit harder, just because being a chronic illness patient, you already have that strain a little bit. Like that's something you really try to find. And if you have a community, you try to keep your community, your interpersonal communications. Like I'm a trainer, so I have clients I see in person that I haven't been seeing. And that's my interaction, my day-to-day. I love my clients. That's what my day-to-day is. Those are the tough aspects. I think might be even tougher for people who have a chronic illness, whereas we might have it a little bit easier with the restrictions because we're like, yeah, okay, restrictions are nothing new. That's like, that's a normal day in our lives. And you guys started touching on it, and we'll kind of close with this, but like, so we've talked about COVID-19 and the illnesses and mental health and what you go through and all the possible outcomes of transplant, or if you don't. What do you do in your life to prevent from living in fear and instead like embracing your life? Who's going to go?
All right. I guess I'll go.
I'm looking at me. Like, who's going first here?
So I've also said this, but I think, living in the moment and trying to maintain a general positive outlook. Being optimistic about our circumstances, even though we're in a difficult situation now, just trying to think about it being short term, that, this too shall pass. Whatever we're in, we can get through. And there's no need to worry also about what may be lying ahead. I think when that comes, we will address it. And, we'll do what we can then. And so I have a good example of this. I was in 2017, I had a lung collapse. Also, was that same one of those hospitalizations. I had 3 that spring, and for all 3, I had to be in the hospital. Required pleurodesis, which is like gluing the lungs to the lung lining, the pleural space. And so anyway, I didn't know, I mean, after the first one, I thought it was the glue would hold my lungs up, but then it happened again 2 months later, and then again 2 months after that. And I had planned a trip that summer. My parents are Hungarian, and they have a house there in Hungary, and I was gonna be going to visit them, and then also do like a trip to Croatia. So it was all planned, and I was super excited. And I had put it off. It was earlier in the year, and I put it off to go later in the summer. And that last lung collapse was in like June, and so I wasn't, I was scared that what if it happened again when I was abroad or on the airplane. It was very, it was very scary, and I didn't know what to do. And I didn't know if I should live in, be fearful that it could happen again and not do something that I really, really wanted to do, or whether I should take the risk and just take it a day at a time. And if I'm there and a lung collapse happens, well, they have hospitals there too. And I would figure it out one way or another. Yep. Something would happen. So, I ended up deciding to go. And I went about like 2 months, 1 to 2 months after that third lung collapse. And I ended up being fine. Luckily, my lungs have still held up since that. So knock on wood. But I was definitely scared. I'm not saying that we never live in fear, right? Because certainly there are times in our lives where we do very much experience fear, but it's being able to control that, to being able to overcome it, and to say, you know what, I'm going to do what I can in my power, and I'm going to let tomorrow bring what it brings, and I'm going to figure it out. And I think that's the way I've been able to accomplish as much as I have, and just to live as vibrant, I guess, of a life, as I have liked, and I feel fulfilled in that. I wouldn't be happy with myself, and I couldn't live a life that was sheltered and where I was scared of what if, and that would not make me happy. I couldn't do that. And so that's why I have pushed past fear, and I just do what I do.
Yep. I totally get that.
So for me, it was, again, what I'm about to say goes back to the point of being in check mentally and how that's going to affect you physically, because I spent my entire existence living in fear. I lived in fear of my abusive father. I lived in fear of bullies in high school. I lived in fear of coming out as a gay man. I'm sick of living in fear. So I've really tried over the past year and a half to live every day in gratitude, finding just something out of each and every day to be grateful for. And I try and find at least 3 things. And it could be the same things, back to back days. It could be something completely different. But I just find having that gratitude list and trying to have an attitude of gratitude really helps propel me towards embracing life rather than being in fear. And I'll just say that, living in fear got me nowhere before. It robbed me of the joy in life. It robbed me of being happy. We can spend our days, day in and day out, with what ifs and, well, what about if this happens? What about if that happens? And, fair enough, but where is that going to get you? And what is that going to allow you to accomplish in life? So instead, I choose to, have goals, have plans. And like Ella said, have a healthy fear of things. Like, obviously, I'm not going to go out and go to like some big slumber party right now and not do things to keep me safe. That would be stupid. That's stupidity, But I'm also not going to not go for a walk because, oh my God, somebody I meet outside may have COVID. As long as I'm doing things that are protecting myself. And for me too, like I know, we've talked about it, the physical part of it really helps me mentally. So staying physical, staying active is really helping my mental health. So I'm not going to not go outside and let fear prevent me from doing so, when that's only going to make me suffer even more so mentally.
Yep.
So
Right.
I think like Ella said, it's all about balance. It's all about, taking that healthy fear and putting it in its perspective. But at the end of the day, for me, it's having that gratitude and, learning to live life, embracing it.
I love that attitude of gratitude. I'm going to
Yeah.
remember that. I love that.
I read it in a book shortly after my rejection. I wish I could remember what book it was in, but it was just it was in a sentence. I don't even think the author meant to, like, but having an attitude of gratitude. It's like the biggest thing that I
love it.
Because it rhymes.
It does. And I liked how you said like 3 things. Like, I did a yoga teacher training a year or 2 years ago. I don't even know anymore. And one of the instructors had mentioned, like, in their household, what they'll do is if someone's getting super grumpy or like having an issue, they're like, name 3 things you're grateful for. Like, it's a really quick way to interrupt, because you guys are right. It's up here. Like, even the fear isn't like, it's legitimate because your emotions are legitimate, but you're creating this response in your head, and then it creates a physiological response in your body. So that means if you're creating it, you can stop it. So your idea of gratitude and those 3 things and those moments of fear are such a wonderful idea. Like, I need to actually remember that too, of like, we're all going to have it, right? You're going to have the little things creep up into your head. It's unrealistic to be like, I'm never going to be fear. No, that's bullshit. Yeah. Like, we're going to have some fear. Things are going to come up, but it's what's going to overcome is gratitude or that fear.
I just find that tool for me, it just brings me back. Mm-hmm. You know, like, I have this thing that I say, it brings me back to Jesus, you know, because it hones me. It helps me. Like this morning, I'm not going to lie, I was feeling really overwhelmed. I've been 10 weeks without work. I don't qualify for any of the federal benefits that they offer here. Right. I'm getting really overwhelmed financially. And then, so I did that gratitude thing, and I was like, okay, so I'm living with my mom. I have a roof over my head, and I have food in the fridge. And I swear to God, it instantly, I was like, oh my God, like, I'm okay. Yep. There's people who are homeless.
Yep.
Do you really have room to complain right now? No. So shut up and move on.
It's like it is.
Yep. It's a grounding exercise, right?
It's like a grounding exercise. It's exactly what it is for me. It's exactly what it is for me.
I like that. And I think that, and because, physical fitness, and we've all been talking about it, but like, it's such a thing. Like, if I don't get to move my body, I am not in a great place, like, mentally. Like, it messes with me more than like a day or 2. Like, it changes things. So because I think physical fitness also grounds you. And I think that combined with this attitude of gratitude is such a great way to go about it.
I've lost audio again because somebody tried to call in.
Oh no.
So are we cluing up now? You can just not.
Yep. So, all right. So we lost Jamie for a second, but I don't know if he can hear me at all. But, oh, wait, maybe he can hear me. Let's see. Oh, he's going to log out and come back in. But that was so amazing to hear both of your stories. I know Jamie's not in the picture right now, but he'll be able to see this little part. And that was the very end. Oh, he's coming back right now. But this was such a great time. Jamie, can you hear us? Yay!
I can. Sorry.
You're fine. I was just saying, it's been so great to have you both. And before we finish, Jamie, there's actually a comment for you from Samuel telling you, giving some feedback and some love and support, saying you don't have to be ashamed of what happened. As you mentioned, we each have different paths with cystic fibrosis, and it probably happens more often than we hear about it. Big kudos to you. You have the courage to be honest about what happened, overcome it, and take it to the outside world to educate people about it.
Oh, that's wonderful.
There's a lot of support out there. And that just got me too.
Yeah.
There's a lot of, we don't realize, but there are so many people that support us and that cheerlead us along the way. I couldn't be where I am without everybody, without the positivity that I've been blessed with. And so I think we just have to remember that, there's going to be people that disagree with us or don't like how we do things, but ultimately they don't matter to our lives. And we're strong, and we know we are, and keep doing what
I would like to take this opportunity to thank you for doing this, because I just feel a very strong sense of connection and community with people. It doesn't matter if they're CF or anything to do with transplant, anybody who has a chronic illness. So I just had to tell you, I think what you're doing is absolutely amazing, and I just hope that you continue to do it and stay inspired to do it, because sadly, I do believe chronic people who suffer from illnesses, our voice isn't heard enough. We're not represented enough in the media. We're not represented enough on TV. And I just give you such kudos, man, for doing something like this. And I have got to say, I've thoroughly enjoyed talking to both of you guys today.
Me too, absolutely.
Thank you both. This has been such a treat. I get so much from talking to other people with chronic illness. And that's why I wanted to do this. Is it's beyond just your individual illness. This is a community of people. We share a similar path in life. And I think that the more this community can come together, the more we can all heal together, grow and learn and be there for each other and live these. I really want everybody with a chronic illness to be able to live the best life possible and just go all out, not hold themselves back mentally, and just know that there is life to be had and it's there for you. And so thank you both so much for doing this. I've learned so much from both of you. I love talking to you both. I feel like through this, we make connections and we're going to be able to continue these conversations and grow. And I'm so grateful. Thank you both so much for joining me.
Thank you for having us.
It's teaching us all that we're more alike than we are different, I believe.
Absolutely.
Thank you both. And I will talk to you soon. Bye.
Bye.